percentage of cure reaches 98% in early detection, compared to 16% in cases that are detected late with large cancers with incurable cancer. Women who have positive family history may need to start earlier, and we usually ask these women, who was affected in your family and at what age were they affected?
All right. It's a very important message to women.
Yes.
So please get your mammograms done and your screenings done. October is known worldwide as Breast Cancer Awareness Month, a time to shed light on the importance of early detection, regular screenings, and the hope that awareness brings. Today, we are joined by Dr. Norran Saeed, Division Chief of Breast Radiology at Al-Zahra Hospital, to help us understand the role of screening, the latest advancements in tests, and why awareness is more than just a pink ribbon. Hello and welcome, Dr. Norran, and thank you for joining us.
Thank you. It's a pleasure to be here.
Dr. Norran, to begin with, we always hear, this sentence, early detection saves lives. We often hear that. Let's elaborate more on that. Why is early detection critically important, specifically in breast cancer cases?
Actually, there's a sentence we always say, which is early detection is the best protection. And this is because when we do early detection or we screen women early by mammograms, we're able to detect small cancers. And detecting cancer when it's very small will help us help the CND have a longer life, have a more easy treatment plan and surgical plan, and help her actually get through with everything she wants to do in order her life much better than if this cancer was detected at a late stage, when it's larger, when it has spread, and when the treatment is going to be very difficult.
But it's more important in breast cancer. Why is that?
Because actually the percentage of cure reaches 98% in early detection, compared to 16% in cases that are detected late with large cancers with incurable cancers.
All right, doctor, at what age should women really start doing the tests and do the screenings? And how important is their family history in that sense?
Inviting women to start screening is usually at age 40. They should do an annual mammogram, starting age 40, and sometimes we need supplemental screening by ultrasound, MRI, or other tests. Women who have positive family history may need to start earlier, and we usually ask these women, who was affected in your family and at what age were they affected? For example, if she said her mother was affected at age 45, she should start screening 10 years younger than that age. So she should start earlier than other women at age 35.
All right, but it differs from one woman to another, right? Individually, if we take one case by case.
What we can say is,
or is there like a common age where we can all start, for example, screen?
Women at average risk of cancer should start at age 40. If you're at high risk, meaning you have family history, genetic factors, you've done a risk assessment tool, you've taken a risk assessment, a modality, and your risk is high, like Angelina Jolie, for example, the risk was really high. So then you should go through another protocol, which includes starting mammograms early, having a breast MRI as well with your mammogram. And this is all according to the Society of Breast Imaging protocol.
Dr. Norran, speaking of mammograms and MRI, there are main screening tools that doctors use today's world, to detect breast cancer, and they're all available today. But how do you, as a doctor, decide which tool is best for which patient?
First, according to age. So if the lady is 30 years or younger, we go straight to ultrasound. And if she has symptoms. If she has symptoms and she's older than the age of 30, we go for mammogram and ultrasound. These are women who have symptoms like a lump, a pain, discharge, what have you. Now, if we're just doing screening, we start huge mammography, that's the basic test. We may add ultrasound as well. And MRI is added in high-risk women. It's also added if we have something suspicious that needs further characterization. Like, for example, an abnormality seen on mammogram, but we're not really sure what it is. Sometimes we need to do MRI for that and for preoperative planning as well.
But why is there so much anxiety, doctor, around mammograms? A lot of women feel anxious about mammograms and they really try to avoid it. So could you explain to us what really happens and walk us through the actual process? Why is it scary?
Okay, let's start with the first reason, which is radiation. That women are afraid that the extra radiation caused by mammograms may cause cancer. And this is absolutely not true. All the international societies have given out a statement that mammograms save lives. And radiation does not cause cancer. The amount of radiation in a mammogram is similar if we took a flight from Dubai to the United States, for example. Okay, the same radiation that's in the air around us. The amount of radiation in a mammogram is equal to about 1 week of background radiation. So the amount of radiation in a mammogram, as long as it's within the international quality standards and protocols, it's absolutely fine. It will save a woman's life, not cause cancer.
All right. It's a very important message to women.
Yes.
So please get your mammograms done and your screenings done. All right. That's really interesting to know. And let's talk about the second reason why women don't do their mammograms.
This is very common also because women are afraid of pain and they think that mammograms are going to be painful or cause them pain. So I want to reassure women that now all the mammography new machines are up to date. The number of pain or the experience of pain is much limited. Also, I advise them to do the mammogram after their period because before their period, usually the breast is sensitive and maybe more painful. So after the period would be a much better time. And also the time of compression that may cause the pain is much less than before. And the devices themselves are more up to date and so the pain is less.
What about the third reason, which is major as well, the fear?
The fear. Now, this is also one of the most important reasons. Fear is something we can't take out of our eyes, but we can think logically. What I want to say is that you're afraid of finding out that you have a problem. But if you leave this problem to go bigger and spread more, this is even more scary. So if you find out something you have is small and can be cured up to 100% even, then it's controllable. It's under control. We can take care of it. We can find out how to treat it and help you live a longer, healthier life.
Of course, JATSAs are better when you discover it or detect it at the early stage. And so this leads us to the question, Doctor, how often do women should get screening? Let's say if they are at average risk or if they are at high risk.
If they're at average risk, just like all women, they can start screening at age 40 annually with the mammograph. And if they're at high risk, then we check who in the family was affected. We also should have a risk assessment to fill up to find out what their risk is, because if they have a high risk, like Angelina Jolie, which we were just discussing, they may consider doing prophylactic or preventative surgeries and treatments, even beside having their annual mammogram and annual MRI of the breast.
The second time you mentioned Angelina Jolie, high risk. Why is she at very high risk? Like, even the high risk differs from one woman to another?
Yes.
How do you tell? Like, what are the factors?
The factors have a lot to do with family history, genetic factor, which is a genetic test called the breast cancer 1 and breast cancer 2 tests, and also to the lifestyle she used. So her analysis showed that she had a risk of more than 95%.
And why was that? Because her family history?
She had her sister, her mother, her aunt, they all have breast cancer. So she decided to go for a preventative mastectomy and reconstruction of the breast so that she can decrease her risk early.
That's a very extreme case, of course.
Yeah.
All right, let's talk quickly about self-exams. Like, a lot of doctors do recommend doing self-exams to help in early detection. Are these really important today, or could we say they're outdated compared to advancements we have today?
Compared to the advancements, they are limited in detecting early breast cancer, but they can guide a woman to understand what the normal breast is. And if she feels something unknown, she would like to go in between screening mammograms to check it out. This is important. Mm-hmm. But actually, when she finds out that she has a lump, the lump is going to be as big, for example, as a lemon or tomato. But when we find it in the mammogram, it's going to be very small, just like a small rice or a lentil or just rag. Yeah.
So it could not be detected by a self-exam. That's what you mean.
If it's small,
if it's very small. I'm intrigued to know, Doctor, is there any misconceptions that you hear or myths that you hear from your patients?
A lot of patients ask about deodorants. They think that deodorants cause breast cancer. And this is not true. There were some researchers that came out and said that aluminium hydroxide is present in some of the roll-on deodorants and that it can cause breast cancer. But other researchers came out and said, no, this is not true. And I always say, if you look at a pack of cigarettes, you have a message on it saying that smoking causes cancer. It's proved. It's there. All the societies approve that. But in deodorant, that's not the case because it hasn't been.
So that's one of the misconceptions you face a lot for a while.
Yes.
All right. Beyond screening, are there any, lifestyle habits that any woman can do to reduce the risk of contracting breast cancer?
Lifestyle is one of the most important risk factors for breast cancer and many diseases. So if we start by saying, first of all, that women should have a good level or a normal level of vitamins, because lots of researchers have found that low levels of vitamin D have been associated with women who have breast cancer. And also, when women have low levels of vitamin D, they don't respond to treatment as well. And so vitamin D is important. The next thing is also sleeping well. They should have at least 7 to 8 hours of sleep. Which brings us to stress, because stress is one of the most important factors affecting not only cancer, but lots of diseases in the body, like allergies, heart disease, stomach ulcers. All these can be affected by stress. Now, the last two are very, very important. What we eat, what we put in our body. Junk food, fried food, fatty food, lots of sugar, all that is very unhealthy and increases the risk of breast cancer and many diseases, and so does smoking. And lastly, exercise. And when I say exercise, of course, I would love women to go to the gym every day and have an hour at least of a workout, but I know that this is difficult. So at least we need 150 minutes of walking per week. And 150 minutes is like half an hour a day. And you can put that in your normal routine. For example, if you go to take your car or take transportation, walk for like 10 minutes before you drive, or park a little bit far. Take the stairs instead of the elevator.
My doctor always said take the stairs, right?
So all of that is just extra movement that can be within these 180 minutes and is going to decrease your risk of breast cancer.
Dr. Norran, before we wrap this up finally, is there like any final message that you'd like to give to women this October regarding prioritizing their breast health and their entire body?
I'd like to tell them to be aware, to always listen to new information, to not get the information from Google searches and internet, get the information from the right source, from the doctors. Go to their doctor if they have any questions. Make sure they have their annual mammogram checkup. And it's a great opportunity in October because there's going to be lots of opportunities to hack this in very good, advanced technology.
And this is the importance of awareness. Like, we can see a lot of initiatives in October, but we hope that this continues, not just in October. Yes. Like, the momentum stays there throughout the year. Thank you, Dr. Norran, for joining us, and thank you for shedding light on this very important topic. Thank you very much. And so let's remember, Breast Cancer Awareness Month is not just about wearing pink, ladies. It's about real action, early detection, and spreading knowledge. Book your screening, encourage your loved ones to do the same, and let's keep the conversation alive beyond October. Stay healthy, and we'll see you in the next episode of Medical Dose.